guess I'm the longest serving here. When I came in, I made an offer to then governor. I made the same offer to every single governor, Republican, Democrat. My office is open to them for anything they want. Take their phone call anytime, day or night, and work with them. And it's been my feeling we've had Republicans and now an independent in our congressional delegation, and one more Democrat delegation. It's been my feeling that every single member of the delegation has made that same offer to all the governors, and sometimes they've called, sometimes they haven't. This, I think, is impressive, and I was thinking this as I drove down from our home in Middlesex this morning. I'm very pleased to see what Governor Shumlin is doing. It's a very difficult time, and this is not a time for politics. This is a time for getting things done. This is a special state, and we have special needs, but we can address those needs. I think we will.
Is it
Let me just say one thing. People think single payer is a radical concept. What everybody should understand is that right now we have 2 single payer programs in the state of Vermont. That's what Dr. Dinosaur is. Talk to the parents of the state of Vermont. They think it's a pretty good program. Other single payer program we have is called Medicare, covering everybody 65 years of age or older. What we are striving to do right now is to fill the gap and make sure that everybody can benefit.
Is it accurate to say that there has to be a change in law in Washington to go forward with what Vermont wants to do this year here? Do you need this legislation change to move ahead with single payer?
You know, there's no question that having the 2014 date is incredibly important to our success. I would not say that anything's impossible, but having the date moved from 2017 to 2014 allows us to use the federal bill to get to work immediately on creating a single exchange, and then using in 2014 the cumulative resources that the federal government would otherwise send to us with strings attached in a collective pool to deliver on a cost containment system for all Vermonters that provides quality care.
Any regrets from the delegation voting for this bill in Washington, knowing now that Vermont may be hamstrung and not be able to move forward with something that you've advocated for years and years?
Well, you know, there was a lot in the bill that could have been much better. I mean, it's really one of the points that I make with Republicans who are saying they want to repeal it. If they have ideas on how to improve it, and I think moving the date up would be one, more cost containment would be another. There's things that need to be improved, and that's what Vermont is about to do. I mean, our whole point here is that if you let a state have the tools it needs and the flexibility that's required, they can help show the way. Vermont's done that.
What about
I would just add, I would just add, national health care reform will provide health insurance for 32 million more Americans. It'll do away with many of the obscenities that now exist with regard to pre-existing conditions. Some of us work very hard to double the number of community health centers. 20 million more Americans will have access to health care, and we've got some tools in there for cost containment. I think we understood what we were voting for, and what we want to do now is make an amendment so that we can lower the date to 2014 to allow this state to lead the nation in a better direction.
what about